Good morning everyone. The topic for today's lecture is breathing exercises. So we have different kind of breathing exercises in your chest physical therapy where we apply different types of techniques to the patient and thereby we get some benefits in terms of improved ventilation, improved capacity of the patient. So today's lecture we see in detail what are the breathing exercises, how do we apply this in patient, and in which all conditions you can apply this breathing exercises. So mainly we have four types of breathing exercises: diaphragmatic breathing, glossopharyngeal breathing, pursed lip breathing, and segmental breathing. So this four we'll see in detail in the session. So definition. So the therapeutic exercises are aimed to deepen inspiration or expiration or even to alter the rate and rhythm of respiration. So you can use these exercises, you can either deepen inspiration in case if you have any kind of restriction that will restrict your lung to expand. That time you can deepen the inspiration by using any of the technique which is suitable, or you can deepen the expiration if the patient is having any kind of obstructive condition and he is feeling it difficult to expire the air out. So that time you can apply the prolonged expiration, or even you can alter the rate and rhythm of the respiration. If the patient's rate of the respiration is much higher, you can alter that by giving the therapeutic exercises. So these are aimed at these all areas. Now, breathing exercises and ventilator training are fundamental interventions for the prevention or comprehensive management of acute and chronic pulmonary disorders. So, we use mainly this in your pulmonary disorders where you have any obstruction, where you have any restriction in the lungs, or you have any other abnormalities. So you can go for the breathing exercises. So always we concentrate on acute or chronic pulmonary conditions. Now we see the goals of breathing exercises. What are the main goals of breathing exercises? So after giving the breathing exercise, what all benefits you can get? There will be a redistribution of ventilation. So when you do any of the suitable breathing exercise, there will be a redistribution of ventilation. There will be increase in the effectiveness of cough mechanism and promote airway clearance. So you can use this technique to promote the cough mechanism and to promote the airway clearance. You can clear the airway, clear the secretions by using any of the technique, and prevent postoperative pulmonary complications. So usually after postoperative, after post surgery, you have many pulmonary complications which will proceed as a result of your anesthesia. So you can prevent all those complications by using the appropriate technique. Then you can improve the strength, endurance and coordination of the muscle of ventilation. So the muscles which we are using for ventilation, you can improve the strength and endurance and also the coordination. Then maintain or improve chest and thoracic spine mobility. So you can also maintain chest and thoracic spinal mobility when you have a restriction, and you can apply this technique when you have a restriction in thoracic expansion. Then correct inefficient or abnormal breathing pattern and decrease the work of breathing. So in certain conditions you may have increased work of breathing where we uses the accessory muscles of respiration for primary inspiration and expiration. So that time the work of breathing increases. So in order to reduce this, you can use some techniques like diaphragmatic breathing, etc. Then to promote relaxation and relative stress. So it is associated with the some kind of relaxation technique where you increase your breathing and slows down your breathing. There will be some control over your relaxation. Then teach the patient to deal with the dyspnea. So if the patient is having breathlessness, so there can be some difficulty for the patient in order to carry out the daily living activities. So in case you can train the breathing exercise and train them to come back to the normal activity. Then improve overall functional capacity for daily living and recreational activities. Now we see the first one, that is diaphragmatic breathing. So as you all know, diaphragm is the primary muscle of inspiration. When the inspiration is happening, diaphragm will descend down and it will push the abdominal contents and the abdomen will bulge out. So when the patient is expiring or the person is expiring, there will be ascending of diaphragm and it will come up and there will be release of the pressure over your abdominal contents and it will come back to a normal position. So this is the normal mechanism which happens when the patient or the person is using diaphragm properly. So when you inspire, the abdomen will bulges and when you expire, it will come back to normal position. So now we see why it is important to facilitate diaphragmatic breathing. So if the patient is having an increased work of breathing, the patient will use accessory muscles of respiration which are intended to use for other functions, but when the patient is having any kind of obstructive condition or restrictive condition, they may rely upon their accessory muscles of respiration. So what happens is, later onwards, as the disease progresses, the diaphragm will reduce the function and the function is taken up by the accessory muscles. So in order to prevent this, we need to train the patient diaphragmatic breathing. So oxygen consumption of muscles of ventilation is very low during quiet and relaxed breathing when functioning effectively. So you can see the picture. So what is the procedure of your diaphragmatic breathing? So in diaphragmatic breathing, you need to make the patient in semi-Fowler's position. So you need to elevate the patient's head and for 45 degree and ask the patient to flex the hip and knee. And why we are adopting this position is, if the patient is using accessory muscles of inspiration, the work of breathing is increased. So their diaphragm will be inactive. So in order to get the relaxed position of diaphragm, we are adopting this position in patients. So you need to make the patient in semi-Fowler's position who are using accessory muscles of respiration. Then you ask the patient to relax shoulder muscles and upper chest and ask the patient to keep a hand over the rectus abdominis muscle. So when you keep the hand over the abdomen, you will have a tactile sensation to feel the movement of diaphragm. So you give the instruction to patient then that inspire through your nose. While you are inspiring, your hand should come up, that means your abdomen should come up, and while you expiring, your abdomen should come down. So you expire through the mouth. Okay, so this is the instruction which you need to give to your patient. Ask the patient to be in semi-Fowler's position. Take deep inspiration through the nose. That time the abdomen has to come up, and ask him to expire through the nose. That time abdomen has to come down. So this is the normal procedure. So where you can train the diaphragmatic breathing. So first, initially when you starting with this, the patient won't be aware or patient won't be able to do this with the diaphragm. So later on, as the therapy session progresses, the patient will be able to control the diaphragmatic movement. So this will happen. So as a progression, so when you get attain this in your semi-Fowler's position, you can progress this. So how do we progress? First thing is positional change. So your diaphragm will be finding it difficult to work in different positions. In supine, it will be difficult for the diaphragm because it has to work in a different direction. So what you need to give is you need to change the position. So you can ask the patient to do this in standing, you can ask the patient to do this when he is walking. So you can train this way the patient the diaphragmatic breathing, and you can increase the progress. And the next thing what you can add to increase or the progress to progress the exercise is that you can add some weight over the abdomen. You can put some weight over the abdomen, and then you can train the patient so that it will strengthen more. So later it will give strength and endurance to your diaphragm, and this is how we usually do the diaphragmatic breathing. So this is the procedure of diaphragmatic breathing. So when the patient is relying on accessory muscles of respiration, you need to give the diaphragmatic breathing, and this is the procedure. And you need to progress as the patient's disease is subsiding and his capacity is increasing. You need to progress the exercise. And the next thing is in which all conditions you can give. So usually in patients who are having obstructive lung disease, there will be a difficulty in expiration of the patient. So what happens? The air will be trapped inside your lungs. So they will more rely on their accessory muscles. So in such conditions you can train the patient diaphragmatic breathing. So as in introduction we have seen that there are some relaxation benefit which we get after doing some kind of exercise. So once after you try this diaphragmatic breathing, you get relaxation also. So these are the training using weights. You can use sandbags, you can slightly head up the position, and you can keep small weights on the epigastric region. You can ask the patient to breathe deeply, and the time and weights can be increased if the patient can sustain for 15 minutes. If the patient sustains this for 15 minutes, you can give this for you can increase the times and weights. And you need to see one more thing, the session. So usually you can give 10 times in a session, that means 10 diaphragmatic breathing in a session, like 3 times in a day you can give for a normal individual. And you need to give rest in between 3 sessions, and immediately after your food you should not give diaphragmatic breathing. Try to avoid all the physical therapy breathing activities immediately after the food. Why? Because when you do this there will be increased abdominal content, food will be there, so this will compress the abdominal content and will make it difficult for the patient. So always try to do after 2 hours of your meal. Then next comes the segmental breathing. So segment wise, how do we train or how do we give the treatment for the patient? So segmental training or breathing you can give usually after thoracic surgery, and you can emphasize that there is expansion of areas of the lungs where there is a pathology. So usually we give segmental breathing after thoracic surgery, and you can emphasize expansion of the area. So basically we have two types of expansion exercise. One is lateral costal expansion and the other one is posterior basal expansion. These are the two segments which we emphasize or focus on to expand. So lateral costal expansion means that we are usually expanding the lateral basal segment where we can apply either unilaterally or bilaterally, and you can shift the lower rib. So usually when we apply this in cases of chronic bronchitis, emphysema or asthma. So these are the some diseases where you can apply lateral costal expansion. And what is the procedure? So you make the patient either in sitting or hook lying, and you keep hands over the lateral aspect of the rib and ask the patient to breathe out and feel the rib cage moving downward and inward. Prior to inspiration, you apply a quick downward and inward stretch which stretch the external intercostal muscles. And you can apply a manual resistance to lower rib area to increase sensory awareness as the patient breathes in deeply and chest expands and the fibers ribs flare. And when the patient breathes out, assist by gently squeezing the rib cage in downward and inward direction. So this is your lateral costal expansion. So in this picture it is shown that the patient is doing it self. So patient is doing it with the band so that he'll get the stretch. So this can be done either self or you can assist the patient. So if the patient is unable to do, you can assist the patient's ventilation by using the lateral costal expansion. And now we see the posterior basal expansion. So the posterior basal expansion usually we apply in post-surgical patient who is confined to the bed in a semi-reclining position for an extended period of time. So this is the indication for your posterior basal expansion. And what is the procedure is, the patient has to sit and lean forward on a pillow and the therapist has to place hands over the posterior aspect of lower lip and cover the area. So the rest of the procedure is same as your lateral costal expansion. You need to give a downward and inward stretch to the lower ribs. So this is the picture showing posterior basal expansion. We try to expand the posterior basal segments by placing the hand over the lower rib area. Now we see the next breathing exercise, that is the glossopharyngeal breathing. So glossopharyngeal breathing means the patient has to take gulps of air and he has to push the air back into the pharynx. So we'll see in which all conditions you will give this. So usually when the patient's inspiratory muscles are failed due to any cervical trauma where there is paralysis of phrenic nerve and diaphragm, you need to give the patient glossopharyngeal breathing so that he can assist the breathing without taking much effort of the accessory muscles or primary muscles of inspiration. So later you can train with the muscle of action. So now we see the procedure and indications. So to increase patient's intercostal when there is severe weakness of muscles of inspiration, and it was developed to assist post polio with severe muscle weakness. And today for in today's this high spinal cord injury patient also we try this. And you can teach the patient who have difficulty in taking a deep breath, and it increases the depth of inspiration and vital capacity. So basically when you take this glossopharyngeal breathing, you don't require the assistance of any of the respiratory muscles, and the patient's respiratory muscles will be completely paralyzed or unable to produce adequate thoracic cage movement in order to take inspiration. So that time you can apply the glossopharyngeal breathing. So this was started as post polio weakness, and that time it was developed, and with spinal cord injury patient also. Now we see the procedure. So what is the procedure? Take several gulps of air. The patient has to do gulping of air 5 or 6 times. Gulp the air and the mouth is closed. Close the mouth and use the tongue to push air back and traps in the pharynx. So as air is forced into lungs, then there is a glottis opening. So what happens is the patient has to take several gulps of air, it can be 5 to 6, and then ask the patient to close mouth and push the air back into pharynx with the tongue. So this is the procedure of glossopharyngeal breathing. Now we have the last breathing exercise, that is pursed lip breathing. Pursed lip breathing means you can give this in patients who are having COPD and dyspnea. So what is COPD condition? This is an obstructive condition where the patient will find it difficult to expire properly. So what happens is, in obstructive conditions there is problem with the expiration. Usually when you take the air inside and when you expire, there is a normal constriction of your airway which is normal during expiration. So when you have this obstructive condition, air will find it difficult to escape through the narrowed airway. So what happens is, there will be trapping of air inside your lungs. So as a result, there can be hyperinflation of lungs and there will be trapping of more air inside your lungs. So this air has to be cleared out from your lungs. So in order to get that, we can use pursed lip breathing. So when the patient is having an obstructive condition and problem with the expiration, we always opt for pursed lip breathing. So in this technique, the patient has to make pursed lip and the expiration should be passive. So what is the instruction you need to give to the patient is, make a pursed lip and expire for a prolonged time, that is at least 4 to 5 seconds, and the expiration should not be prolonged. So you give a proper prolonged normal, within the limit normal prolonged expiration, and there should not be any contraction of abdominals, and you can breathe slowly, then exhale. So this is the procedure. So the patient has to make a pursed lip and expire to a prolonged or extended time, so that the air trapped inside your lung will be expired out, so that the hyperinflation or the flattening of diaphragm, all the complications we can reduce by doing this pursed lip breathing. So what is the benefit? It decreases the respiratory rate and it increases the tidal volume. It improves the exercise tolerance, and use of forced expiration during pursed lip breathing should be avoided. That means you need to give a passive expiration. Forced expiration should not be given and the abdominal muscle should be relaxed. So this is the pursed lip breathing. So now we keep a look on, or now we just summarize the portions which we have seen. So mainly you need to give this breathing exercise either to deepen the expiration or inspiration, or in some other pulmonary conditions. So why we use this? In order to improve the ventilation, in order to strengthen the muscle, to reduce the work of breathing, and to give some relaxation to the patient, and functionally make the patient active in doing the daily living activities, and as well train them functionally to get back to their work. So that is the main aim of your breathing exercises. Now we see what are the normal 4 types of breathing exercise we have. So first one is diaphragmatic breathing exercise, glossopharyngeal breathing exercise, segmental breathing exercise, and pursed lip breathing exercise. So these are the 4 normal breathing exercise which we give in pulmonary conditions. So the first one is diaphragmatic breathing exercise. So when the patient is inspiring by using accessory muscles of respiration, we use the diaphragmatic breathing. And first we start in the semi reclining position, so that the diaphragm will be relaxed. Then we progress as the patient is able to maintain the normal functional level of the diaphragm. So we can train the patient in sitting, standing, even during functional activities, and you can even add some weight over the epigastric area and train the patient, which will strengthen the diaphragm. And what is the procedure of diaphragmatic breathing is, just you give start giving instruction. Ask the patient to be in a semi-reclining position so that the diaphragm is relaxed. Then you give instruction that take deep inspiration through nose, and that time your abdomen should come up, and expire through your mouth. That time your abdomen should come down. So this is the normal instruction which you have to give during your diaphragmatic breathing, and this you can use in order to treat the dyspnea and to relieve the work over the accessory muscles of respiration. And the next one is your segmental breathing exercise, which means that you need to expand some areas of lungs so that you can get a proper ventilation to that area. So normally we have two types: lateral coastal expansion and posterior basal expansion. So what is lateral coastal expansion is that you keep your hands over the lateral aspect of the rib and apply a downward and inward stretch while expiration. And in posterior basal expansion, you keep your hands over the posterior aspect of the lower ribs so that you can give a downward and inward stretch to the patient. Then next comes your glossopharyngeal breathing. So glossopharyngeal breathing usually focuses on the engulf or gulping of the air so that you can push with the tongue back, and whenever the air is needed you can train in this way. And this usually we give when the patient's diaphragm and inspiratory muscles are paralyzed due to either polio or spinal cord injury, or in any of the condition same way which is causing the inspiratory muscle paralysis. So you can train the patient by giving glossopharyngeal breathing. So what is the main aim of that is the patient has to make a gulp, 5 or 6 gulps of air, then he has to close the mouth and push the air with the tongue back into the pharynx. So this is what your glossopharyngeal breathing. And then comes the pursed lip breathing. So in patients who are having obstructive conditions, there will be problem with the expiration and there will be trapping of air inside your lung. So what you need to give is you need to eliminate or you need to clear out the excess air which is accumulated inside your lungs. So in order to clear that, we need to give pursed lip breathing. So how do we train the pursed lip breathing? So you ask the patient to make a pursed lip and prolong the expiration so that the air trapped inside the lungs will be cleared off after doing this. So this is the main aim of your pursed lip breathing. So these are the main 4 breathing exercises which you can apply in your patients. So the indications are different and you need to keep the instruction clear to the patient. And one thing you can make out in this, that the patient whoever is conscious or actively participating in an exercise can be treated with the breathing exercise and according to the condition. So people who are not able to follow your commands, you can't go with the breathing exercises. So always make sure that the patient is following the command and you give the instruction to the patient, and if required you can even demonstrate the technique to the patient. So this is the main aim of your, or this is the main thing that you need to consider when you do a clinical practice. So always give instruction to the patient and just go with the treatment. So you can give any of the treatment according to the indication of the patient, so that it will be helping the patient to improve the ventilation, improve the thoracic expansion or lung compliance, and thereby increase their functional activity and give a relaxation also adding to this. So now you need to see the references. So you can check this in Therapeutic Exercises, Caroline Kistner. In Caroline Kistner we have a chapter on breathing exercise that you can refer. Then cash textbook. So cash textbook of cardiology, you get the breathing exercises and Egan's fundamentals of respiratory care. So you can see that in Egan's fundamentals of respiratory care also. So these are some of the references which include your breathing exercise. You can refer this and be prepared and come for the session in your Google Meet practical class so that we can discuss the same portion. Thank you.